almost always whispered after the door is closed, is this: Dr. Ricardo, is it possible I'm hurting myself, during masturbation? Things have changed. It doesn't feel the same anymore, and I'm afraid I might be causing some permanent damage. This question, laden with shame and confusion, is perhaps the most common secret pain I encounter in my practice. It's the fear that their bodies are broken, and, worse, the fear of having absolutely no one to validate whether what they feel or do is normal, or if it's dangerous to their health in this new phase of life. If you've ever had this thought or felt confused about the changes in your body, I want you to hear this now. You are not alone. And yes, the answer is yes. It is absolutely possible to be causing silent damage. The real problem is that nobody talks about it. Society, and sometimes even the medical community, acts as if male sexuality simply disappears or stops at age 60. This is not just a myth. It's a dangerous disservice that leaves men like you in the dark, afraid of causing microtraumas or even fibrosis. I am Dr. Ricardo, a senior urologist with over 25 years of clinical practice, focused precisely on the health and vitality of men over 50 and 60. Today, we are going to break this taboo. I will reveal the 7 silent mistakes I see in my office that may be harming your sexual function, and I will give you practical advice to ensure a safe and healthy sex life for decades to come. But before we detail the first mistake, I need to establish one fundamental thing. My goal here today is by no means to cause judgment or embarrassment. My goal as your doctor is to inform, protect, and empower. I want this channel to be a safe space, a place where you can finally have the honest conversations about your health that you may never have had. To solidify this, I ask for your help. If you agree that older men deserve and need clear, direct, and unashamed information about their sexual health, comment below "Health Without Taboo." This signals to me and to all the other men watching that this is a community of mutual support. And if you believe in this mission and want access to medical information that truly respects your stage of life, do yourself a favor, click the subscribe button now and activate the bell. What we will discuss next is crucial. The first mistake, and the most common one I see, is the lack of lubrication. Many men think that if they never needed it before, they don't need it now. This is clinically incorrect. The fact is, as we age, the skin of the penis, like the skin on the rest of the body, becomes thinner, less elastic, and produces less natural lubrication. The risk, the silent damage, is friction. This dry friction causes what we call microtrauma. Think of it, Helix 2, like trying to start the engine of a classic car without oil. You're grinding the parts. These small fissures in the skin may not hurt immediately, but they create chronic inflammation and can lead to scarring. The urologist's correction is simple. Lubrication is not optional, it's mandatory. Use a high-quality, water-based or silicone-based lubricant generously. This protects the tissue and makes the experience safer. The second silent mistake is something we call the death grip. The fact, this is conditioning. It's the habit of applying excessive pressure and a very fast, much more intense rhythm than normal stimulation. The risk is clinically serious. It's called neural desensitization. Think of it this way. Helix 2, it's like using headphones at maximum volume for years. Eventually, you damage your hearing to normal sounds. By applying so much force, you are anesthetizing the delicate nerve receptors of the penis. This makes stimulation from a partner seem insufficient, leading to difficulty reaching climax in real situations. The urologist's correction is to focus on reconditioning. Vary your grip, use your non-dominant hand, reduce the pressure and rediscover sensation, not force. The third mistake, and perhaps the most dangerous, is ignoring your body's stop signal. The fact is, many men feel a twinge, discomfort, or sharp pain and, out of shame or frustration, continue. The risk here is immense. Pain is never normal. Pain is your body's fire alarm. Ignoring it is like removing the battery from the alarm while the house is burning. You may be in the YARASA, early stages of Peyronie's disease, which, Helix 2, is basically an internal scar forming in the erectile tissue, often caused by microtrauma. Continuing with pain can transform mild inflammation into permanent tissue fibrosis, leading to painful curvatures and erectile dysfunction. The urologist's correction is absolute. The rule is no pain. At the first sign of real pain, stop immediately. If it persists, you need evaluation. The fourth mistake is about frequency, but not in the way you think. The fact is, it's not about a magic number. The mistake lies in the extremes: compulsion or total abstinence. Compulsion several times a day doesn't give the tissue time to recover, causing inflammation and fatigue in the corpora cavernosa. Helix 2, the two sponges that fill with blood for an erection. On the other hand, the fear that leads to total abstinence is also harmful. Penile tissue needs regular erections to maintain oxygenation. The correction is balance. But this ties into the fifth mistake: poor hygiene. Not cleaning the area properly before and after, especially in uncircumcised men, can introduce bacteria, leading to infections and balanitis, a painful inflammation of the glands. The correction is simple. Basic hygiene with water and neutral soap protects the sensitive tissue. The sixth mistake concerns technique and position, specifically the danger of doing this lying on your stomach, pressing the penis against the mattress or pillow. The fact is that this position applies immense and unnatural pressure to the base of the penis. The risk is vascular trauma and stress on the ligaments that support the penis. Helix 2. Think of it as bending a plastic straw forcefully in the same place repeatedly. Eventually, the plastic creases and the flow is interrupted. You are crushing the delicate blood vessels against your own pelvic bone. This can silently, over the years, contribute to fibrosis and erection difficulties, as blood simply can no longer flow as easily into the corpora cavernosa. Urologist's correction. Avoid this position. Prefer sitting or lying on your back positions, which allow free blood flow without compression. Finally, the seventh silent mistake is the most systemic. It's ignoring that your sexual health is a direct reflection of your overall health, especially your cardiovascular health. The fact: many men forget that an erection is fundamentally a blood flow event. The risk is twofold. First, dehydration. If you don't drink enough water, your blood volume or volemia decreases. Helix 2. It's like trying to fill a water balloon with a hose that has low pressure. The blood becomes thicker and has difficulty filling the corpora cavernosa. Second, what clogs the arteries of your heart also clogs the arteries of your penis, which are even smaller. The correction is the most important advice I give. Treat your body as a system. Drink water. What's good for your heart? Walking, controlling your sugar, eating well, is the best thing you can do for your erectile function. I know we covered a lot of clinical information, many errors and risks. It may seem daunting, but the practical solution, what I really want you to remember from this video, can be summarized in 3 non-negotiable principles for your sexual health going forward. I call them the senior safety triad. First, lubrication is mandatory. It's not an option, it's protection. Think of it like engine oil protecting your tissue from friction and microtrauma. Second, the absolute rule of no pain. Pain is not pleasure. Pain is your body screaming that there is damage. At the first sign, stop. Don't negotiate with pain, as it may be a warning sign of fibrosis or Peyronie's disease. And third, the importance of hydration and blood flow. Your erectile health is a cardiovascular event. Drink water, because your blood volume matters, and remember that what's good for your heart is what allows blood to flow where it needs to go. I want you to leave this video today understanding one thing, and this is the most important thing I've said. Your sexuality doesn't have an expiration date. Your body isn't an old car that you simply discard because it's 60 or 70 years old. It's a complex system that needs a different kind of care, a smarter and more attentive care. Knowing your body at this stage of life, understanding how to protect it, is not shameful. It's essential. It's an act of self-respect and vitality. For a long time, you may have carried that secret pain, that fear of being broken. Let me be clear as your doctor. You are not broken. You are not damaged. You just didn't have the correct instruction manual for this stage of life. Now you do. If this information helped you, if you feel a little more secure and a little more informed than when you clicked on this video, then I have fulfilled my mission today. My commitment on this channel is to continue having these conversations, to provide the instruction manual you never received. If you believe that this type of honest, clinically based, and taboo-free information is valuable, join this community of men who take their health and vitality seriously. Subscribe to the channel, leave a like so that this message reaches more men who need it, and know that I read and value your comments. Take care of yourself, stay informed, and I'll see you in the next video.